everyone, my name is Jessica Reeker, Community Health Educator with Good Shepherd Healthcare System. Today we're going to talk about face masks and how to wear them. So we have a bunch of different ones we're going to talk about today, and if you don't have a mask, we'll talk about making one at home with things you have around the house. So first off, before we get into different masks, there are 5 things you need to remember about a face mask. They should always go over your nose, cover your mouth, and over your chin. Should be secured behind the head at the top of the crown of your head and your neck, or secured with ear loops with elastic behind your ears. Okay, they should fit snug across your face and have multiple layers of fabric to provide that filtration. And individuals under the age of 2 or that have difficulty breathing are recommended not to wear a face mask. So speak to your provider about that if you have issues, okay? And masks also should be able to be laundered. It's important to get to clean those about once a week or so at least. So first of all, we're going to talk about a few different cloth masks that you might have. First cloth mask is one like this you've probably seen. So they tie around, again, the crown of your head here, bottom strap goes around the back of your neck, and then you will put over your nose, over the chin, and then form around the nose if you have a piece here, okay? A lot of them, some do, some don't. So if you do, you can form this around your nose. The important thing is just to remember that it goes from your nose, bridge of your nose, all the way over, down over your chin, okay? Next up is another cloth mask. Same idea here, gonna go over the bridge of your nose, around under your chin, but this one has ear straps here, these loops. So they will loop behind your ears, okay? Again, both of these have multiple layers of fabric, so it's kind of hard to tell, but this does have 2 layers at least here, and some do allow you to put a filter in there. You can use a coffee filter if you desire. CDC is not recommending that currently. It's not required, but definitely if you'd like that extra protection. And then for anyone who's visited the hospital or a healthcare provider, you might have a simple mask or a procedure mask, surgical mask. So this is with the ear loops. So with this one, you want to place over your face, again, over your ears, down over your chin and your nose, and then pinch this little conform strip here over your nose. Okay, so fully covered from here to here, multiple layers, still able to breathe normally, no restriction in movement or breathing, anything like that, okay? Important point to remember when taking off your mask. Do not touch the front of the mask. This is what's considered contaminated. You will remove your mask using these straps and remove and place somewhere that you are placing your mask every single time. So a designated place in your house where you are putting your dirty mask. We recommend a paper bag or something like that that you can place it so you're not just throwing it down on your counter. Place it in the bag, and then next time you need to use it, you will grab it again by these strings and then place over and like this, okay? So that you have your mask on again. So what do you do if you don't have one of these masks already? I'm gonna show you one way that you can make a mask at home. There are other ways from the CDC using a t-shirt, no-sew methods and sew methods. So I know you've all seen that people are making masks, which is wonderful, and everyone's making masks like this. But if you don't have the means to do this, I'm gonna show you an easy way to make a reusable face mask. So today I'm going to be using this bandana. This is a normal size bandana here. If you don't have a bandana, you can use any square piece of fabric like this. It's about 20 by 20. So what we're going to do, we're going to lay it down and fold it in half here. Okay. Next up, we are going to fold the bottom inward, about 1/3 or so, and then the top down. Just like this, okay, so that they meet in the middle. Then we are going to take 2 pieces of either elastic or rubber bands, hair ties, anything like that that you might have, and you are going to put them around the edges here, about a hand width in from the outside. Should look like a big piece of candy. All right. So we have our loops. These are what's going to end up going behind our ears. Next, we're going to fold these inward so that they touch right in the middle. Okay, so when you get to this point, this is where you should be. You should have your ear loops here, touching in the middle. And then this is going to go straight on your face. So this holding on your face will actually keep it together. So here we go. Straight over, nose and chin, and there's my mask. So you can see again, over the nose, over the chin, looped behind my ears, no restriction, still able to breathe normally, free range of my hands, okay? And I'm good to go. All right, so again, when you're removing this mask, just make sure that you place this somewhere designated. If you want to use it again at home, you'll have to put it somewhere in whatever designated dirty area you're using in your house, because this will be dirty. So you'll place this in whatever dirty area you are using. And then remember that all of these masks are reusable, so please reuse them. Please launder them regularly. Okay, and keep them in a dirty area of your house. Don't shove them in your purse, don't throw them on your counter, don't throw them in the seat of your car, things like that. They are considered dirty after you wear them, okay? So just keep that in mind. If you have any questions, the CDC does have recommendations on these. This is where all of this was received. You can see behind me here. Do's and don'ts of cloth face coverings. Information is rapidly changing. However, they are recommending this now for everyone when you are out in the public, especially when you are going to the grocery store or other high contamination areas, okay? When it's not possible to stay further than 6 feet away from people at all times, okay? So if you have any questions, contact your healthcare provider, see the CDC online, and from all of us here at Good Shepherd, stay healthy, and we're all in this together.